Good morning. So I'm so excited to be here today on this kind of start of the hopefully healthier new year for everybody. And just to update you, I got my vaccine yesterday and I'm feeling fine. I'm very excited to have a doctor joining us today that we're going to do an interview with from Turkey. She's a very well-respected plastic surgeon in Istanbul. We have so far kind of traveled the globe. We've been to the Middle East, we've been to the Philippines, the Caribbean, to India, Romania, and now to Turkey, all during COVID. And I think it really has improved our communication both globally and nationally with our ability to reach out on social media to our patients, to physicians, and have this exchange of ideas. Now, some of the things that we have done is we've talked about melasma, we've talked about treating patients with darker skin depending on the population that you have. We've talked about patients with lighter skin, for example, when we were talking about Romania and the patients that make up a lot of that population. We have talked about sensitive skin patients, and today we're going to change our topic a little bit, and we're going to talk about how to incorporate skincare with surgery. So a lot of the doctors that are in the aesthetic field are seeing that you can do the most beautiful surgery, but if you're not making sure that the skin looks its best, then we're maybe not getting the full result that we want. So we're waiting for Dr. Billur to join us. I'm going to wave to everybody that's joining us right now already. And let me just make sure that she's not having an issue joining here. So hopefully she'll join us here shortly. And so what we find we were talking about before is trying to incorporate skincare with surgery. And it's one of the things that we like to kind of maybe phrase it in the sense that it's about having the icing on the cake. So you can do the surgery, you can make the face look as good as it can, but if the final finish on that surgery isn't a skin that has a nice glow to it, a nice texture, then we haven't given that patient truly the ultimate result. So I like to always focus on having people using a good skincare regimen leading up to surgery, maybe to enhance their results and to reduce their recovery time, and then doing the doing the skincare after surgery to make sure that, here we go, Dr. Billur has joined, and we just need to wait for her to request to come on board. Sorry, bear with us while we get into these technical glitches here. Let me grab her right here. All right, so one moment. Sorry, so if I'm talking and I'm kind of gibbering here a little bit, it's because I'm trying to multitask and talk to you guys and make sure that I allow her to join at the same time. So hopefully she'll join us here. I just sent her the message. And one of the things I wish I could do, I wish I could find a way to share photos on this Instagram Live, because I think whatever subject we're talking about, the way to bring it home is to really show you before and after pictures. And I have so many different ones. We have pictures of patients who simply had skin resurfacing procedures, or patients that have had facelifts or eye lifts. And then it really shows you that when you also address the skin on top of all of that, the results are just that much more fantastic. So we're waiting for Dr. Billur. And I just got a message saying she was unable to join. Let me send a message again. Bear with us. All right, so we'll see if we can get her to join now. We'll send another message. All right, so I'm hoping, though, while we're waiting, that all of you guys have had a fantastic holiday, and hopefully 2021 is healthy for all of us. And like I said yesterday, I got my shot. So it really was no big deal. I got the Pfizer BioNTech shot. So I'll get another one in about 28 days, and then hopefully that means I'll be 98% protected. And I'm hoping it protects against all the strains that are coming out. And hopefully this will roll out to all of our patients and our family members so that everybody is protected, and then we can go back to life as normal as much as we can. So hopefully, it says again she's unable to join. Let's see. Let me try one more thing here. Let's try this account for her. All right, well, we'll answer some questions here. What's the difference between vitamin C and clarifying serum from Obagi? That's a great question. Vitamin C Professional, 10%, 15%, 20%, is straight vitamin C L-ascorbic acid. And that's a great antioxidant for the skin that helps to protect against some of the damaging rays that make it through your sunscreen. At the same time, the clarifying serum is the 10% vitamin C L-ascorbic acid combined with hydroquinone, or in the clarifying serum FX, it's combined with arbutin, which is a non-hydroquinone skin lightening agent, so that you're doing two things in one. And sorry, here, one moment. I just got another message that she's still unable to join. So the clarifying serum is two products in one, and it allows you to put a product on your skin in the morning and in the evening that's compatible with your exfoliating lotions, such as the Exfoderm or the IDR, and it's compatible with your retinoids at night. So this way you're getting extra antioxidants into the skin, and at the same time clarifying the skin with the hydroquinone that's in there. All right, let's see. We'll try one more time to get her to join, and we may have to try something different here. All right. Let me see if we can do one more invitation, and then we may have to find a different way to do this. All right, 1 second here. Okay.
Thankfully.
Yay.
I'm so sorry, Dr. Obagi. I think I'm a little bit of a klutz when it comes to technology, and I was trying to switch back and forth through the different accounts, but thankfully I'm here. I'm so sorry to keep you waiting.
Hopefully, no, not at all. It's very nice.
It hasn't been too much of a problem. Absolutely.
No, it's very, very nice to connect with you. I was just giving an introduction about kind of the different countries we visited during COVID, and how, if anything good came of it, it's that we were able to share so many ideas across the globe with colleagues such as yourself.
Absolutely.
And to share the same knowledge at the same time with our followers who may be physicians, estheticians, patients, and physicians' assistants. It's amazing to be able to kind of get that information out there. And so far we've toured the Middle East, the Philippines, the Caribbean, India, Romania, and now to Turkey, which I have to say, Istanbul is one of the most beautiful cities I've been to.
Oh, thank you so much. We hope to have you back here as soon as possible.
That would be my pleasure. Now, we've talked about melasma with different doctors in terms of addressing those patients. We've talked about treating patients with darker skin, patients with lighter skin, sensitive skin, and now we're coming to you to talk about how to incorporate surgery and skin.
Perfect.
Because one has to go with the other. You can't have one without the other if you want to look your best.
I totally agree. I was very fortunate to be able to attend a few of your previous meetings. And something that has stuck to me so much is that you said that if you wanted to have a good surgery, a successful surgery, you have to operate on healthy skin. So do you want to operate on sick skin or healthy skin? So this actually goes for all surgeries. You actually want to prepare a patient before surgery, whether it be for general surgery or brain surgery or anything. So I think the same goes for plastic surgery as well. And oftentimes I find that the plastic surgery patient, especially the aesthetic surgery patient, is very rushing to get a really good result right away and thinks that surgery is just a very quick fix and can just do everything at the same time. But I think that oftentimes we have to take the time, look at our patient and see what they actually need to actually get the best result. So I'm very, very happy to be able to provide my patients with Obagi products, especially the new derm system. And today I wanted to learn a little bit more about what your feedback could be about how we can prepare our patients, especially in the preoperative phase. So usually our patients, my patients, many of my colleagues' patients, they come to us with the general signs of aging. So photo aging, aging due to gravitational forces, and just the natural course of aging as well. And they say they look tired, they look dull, they look aged, and they just want to look more youthful. They want to look more fresh. They just want to look the best possible version of themselves. What should be the first thing that we should address when a patient comes to us? First, they maybe say, you know, I want to have a facelift. And they say, because I want to look more youthful, I want to look more fresh, I want to look like the best version of myself. How should we go about with this?
Absolutely. So one of the things I like to explain to patients, because they kind of know what it is that they're looking for, but they might not necessarily know everything that they need to achieve that. So they might come in and say, you know what, I want to be pulled a little bit tighter, and now it's going to make me look younger. And, you know, you and I both know tighter doesn't always equal younger, because then we have other issues that go along with that, starting with the complexion of the skin, the glow of the skin, to the volume that they need, because tighter, if you don't restore volume, doesn't also make them look younger, it just makes them look tighter. So Absolutely. A lot of times what I like to do is re-educate the patient about what it is to look younger. Younger is, if you look at children and look at the skin of a child, younger skin is free of environmental damage. It has a nice glow. It's they've got that volume that we start to lose when we hit 20 years of age on up. So children kind of are almost the ideal of what youth is. And you know, they've got the volume, the good skin, all of that. And then we start to lose that starting around 18 or 20 years of age. And it's a slow, constant decline. And so when a patient comes in their 40s or 50s and are starting to feel that they're looking aged, we have to address it on multiple factors, whether it's, you know, restoring the volume that's lost, resurfacing the skin. I phrase it in the sense of the 4 R's: restoring lost volume, resurfacing damaged skin, relaxing overactive lines, and redraping with the surgeries or non-surgical procedures, the looser skin. So when I tell the patients all of that, they understand that you can't just pick one thing and then that's going to be the magic bullet that makes you look young. It's going to be maybe a dabble in each of those. And then the 5th R that I like to phrase it for them in is that you have to keep renewing, skin and surgical results. As you know, the minute you're done with the surgery, that's the best that patient is going to look. And then the minute they leave your office, the aging process starts again, and the results will slowly start to decline. So what I tell them is you have to constantly undergo a renewal process. You have to use your products. You have to use lasers or peels strategically. You still have to do your neuromodulators, your fillers, to maintain all of that. So I think once we educate our patients well, they understand that you're telling them what's in their best interest. You're not there to just sell them a service, like a facelift and you're done. You're right there to be their doctor forever, to make them look their best forever.
That's perfect. Of course, I'm nowhere near your expertise in the sense of following up with patients and skincare, but I have been very lucky in that I've had a subset of patients that I have followed up for about a decade, maybe over a decade, I can say. And it's been really nice to see how their face and their skin responds to all of the things that I have done. Because I started out maybe with just neuromodulators and fillers, and then I added on some skincare. I did some surgeries, and it's just very powerful to see the effect that all of these things can have over a very long span of time. So you can see the progress that you can make with the patient. And actually, sometimes you see that the things that you do are maybe not enough, and you need to incorporate something extra after a couple of years. With patients that you've had for a long time, it's easier to motivate them and they trust you because you've sort of opened up that line of communication, and they will just do what you say because they trust you. But sometimes some patients come that are overly anxious about getting results fast. How would you go about with those patients? Would you automatically, you know, do a surgery and then add on the treatment, or would you just talk to them and then see if maybe they're not a good candidate at all? Because some patients, they are really very, very, I would say, sort of, they're trying to push you towards getting the surgery right away. They say they don't have the time. They're just, you know, they have this short span of time to get the surgery. How would you go about with those kinds of patients?
Right. So you're right. I've been doing this 20 years now. And so I've been in practice a lot longer, and I've had the fortunate ability to follow these patients longitudinally. And what's interesting is that two of my very first patients, when I was actually a fellow still, were 50 and 51 when they came in, and they're very close friends of mine now. And they're 70 and 71 at this point, and they still look better than when they came in.
Oh, wow.
Now, that's not just all skincare. Of course, it's lasers and procedures throughout time, but they are the walking advertisement. So when they go anywhere in public or into a doctor's office or into the stores, they're constantly getting stopped, and people are asking them about their skin. If they go to a makeup counter, the person there is asking them what they're doing for their skin, as opposed to trying to sell them the product. So they become your walking advertisement for you. So over time, stick to your guns, because those patients will then bring in so many referrals just based on how good they look. But we do all experience those patients where we see them and they just want a procedure tomorrow. They waited so long to get a consult with you, and they don't want to wait another 6 weeks to start a skincare regimen and then go on to their procedure. So sometimes I will tell them, okay, because we're pressed for time, we're going to do this, and we'll schedule you in for your surgery in a few weeks or 6 weeks or so. But start today doing X, Y, and Z for your skin, because you will look better once we do the procedure. Especially if I'm doing an eye lift, for example, or a mini facelift, and I think that they're very wrinkled and damaged, I still need to resurface that skin. And I tell them that, you know, I'm giving you a set of instructions to follow before surgery. You can't take blood thinners, you can't be on aspirin. You also want to be on a product regimen that's going to make sure that if you're going to spend the money and take the time to recover, that you're going to get the most collagen production in your skin when I laser or peel you. So I think just phrasing it that way, we know it's going to take them 4 to 6 weeks to come in for surgery. At least they're doing something during that short time to really prep the skin. And I think when I phrase it as, it's as important to do that as it is to stop your aspirin or to take these antibiotics or things like that. So it becomes a mandatory part of their regimen. And I tell them, I can't come home with you to make sure you're doing it, but I'm just telling you what's in your best interest. I'm not here just to do the procedure. I want to make sure you look your best, and I want to make sure that I'm taking care of you forever.
Absolutely. And can I also ask, because sometimes my patients are very reluctant with their skincare, in regards to, they see how effective it is, especially my new derm system patients. Of course, some of them sometimes can experience some irritation in the beginning, in which case I tell them to sort of use some of those irritating products a bit more, like every other day, until their skin adapts to it. In the sense that we're going into surgery, would you say that there is a requirement to maybe stop the skincare maybe 2 days before the surgery, anything like that, or can they just use it all the way up to surgery? What would you say would be the best way to sort of use a timeline in regards to up to surgery with their skincare?
That's a good question. So a couple of things. First of all, if patients are having trouble with irritation and dryness and peeling, and they're going to quit the regimen, as much as I do think the new derm system is very effective and very strong, it's the ability to keep a patient on a skincare regimen that sometimes supersedes the product regimen that you've put. You need to keep them on that regimen. And that's where I incorporate a lot of the Suzan OBAGI MD line, because it's meant to complement the new derm system as well. If you just can't have a patient tolerating, for example, the whole system without undue irritation, then I will still use a key component of that, which is the clear, if I need to clean up their pigmentation, but I'll switch them to the intensive daily repair, Redavance 5 nights a week, the retinoic acid twice a week, so that they're building collagen. I'll put them on the soothing complex to help them rehydrate the skin, and I'll give them a non-irritating mineral-based sunscreen, such as a physical defense, all of which are formulated to really calm the skin with the antioxidants and the chamomile extracts and the different hyaluronic acid bases that are in the different ones, so that they're still getting the improvement in their skin, but they're not being dried out so much that they're going to quit. If I can get a patient on a regimen 2-3 months, for example, and they've gone through 2 cycles of skin cell turnover, then I'll have them use it up until the day of surgery. On the other side, if I really need to resurface them aggressively and I have a short window to get them there, and let's say I'm doing it in 4 weeks, then I may have them stop 1 or 2 days beforehand if I was more new to doing skin resurfacing and chemical peels. I've been doing this for 20 years, so I can kind of read how fast my peel is penetrating, so I can still have them in my hands, use it up until the day of surgery. So it comes back down to your comfort level and what you are able to do with your skin resurfacing on someone who may have been peeling and shedding, because you know they're going to have hot spots. They're going to have areas where that peel is going to penetrate very quickly. Right. Or if they have too much dryness on the skin, the peel won't penetrate through that. But if you're comfortable doing that, you can have them use it up until the day of surgery. So it really comes down to your preference when it, from that standpoint. Then once they've healed from the surgery, from the skin resurfacing, I don't wait until trouble pops up to start them back on a regimen. I will restart their skincare regimen immediately at day 7 or 10, so that they're controlling that pigmentation. I may let them go 10, 12 days if they're very fair complected and they have sensitive skin, and I'll use a couple of days there first to just calm the skin back down and rehydrate it. But if they have any pigmentation issues, I don't wait. I get them back on day 7 or 8 and start them aggressively on their skincare regimen. Quickly.
Okay. All right.
Because by the time you start to see post-inflammatory hyperpigmentation in the skin, that means that those pigment cells have produced enough pigment that they've covered the entire epidermis now with that pigment. So by the time you can clinically see it, it's already a little bit too late, because it's already populated the entire epidermis. So what I would rather do is, if I have a suspicion that a patient is at risk for PIH, then I will restart them on their regimen at day 7 so that I can control it before we can even see it.
Perfect. Well, that's actually all on your expertise and all of your knowledge, but thank you for sharing that important tip with us. How about, is this the same with not just for surgery, but also for lasers and other chemical peels? Would you basically follow the same regimen post procedure?
Absolutely. And actually, if I'm doing a laser that's not fully ablative, like a non-ablative fractionated laser treatment, or even not a fractionated laser. If I'm doing pulse dye laser or intense pulse light, any of those lasers where I'm not really creating a deep wound in the skin, I may restart the regimen at 5 days out. So I'll give you an example. I have a lot of patients of Middle Eastern or Asian descent who come in and they need a pigment laser for some of their larger lentigines or sunspots. Those patients are also the ones who are going to hyperpigment. So I will do the laser, and even though they may still have crusting on the skin, at day 5, I will have them resume their entire regimen again. It won't delay the wound healing, but what it will do is it'll start to drive that hydroquinone or the arbutin or the lightening agents deep into the skin, so that you're shutting down that rebound pigmentation that's going to happen.
Right. So if you were to have a patient that actually required all of them, so basically laser resurfacing plus, of course, the topical treatments and also surgery, how would you go about sort of placing them? So would you start with lasers, or would you start with surgery, or would you do them at the same time? So how would you sort of prefer to sort of balance them out when you're treating a very, I would say, overly photo-aged, overly wrinkled skin?
So I love that total transformation, which I know you do too. You know,
yeah,
you want
I love
to
that.
do something and have someone come out 10 days later looking phenomenal. So I like to maximize as much as I can in one visit, in one surgical procedure. Doing that, though, it's critical to do things in the correct order, because I'll walk you kind of through the steps that I do. So in my hands, it's going to be a little bit different, because I do all my surgeries on patients who are just under local anesthesia and oral sedation. So they're, for the most part, awake. And so I know in my hands, if I'm doing a treatment on a patient who's awake, they're going to, if they feel any discomfort during the chemical peel, their blood pressure is going to go up. So I'm going to do my peel before I do the facelift or before I do the eye lift, because they're awake and I don't want that spike and I don't want a hematoma.
Right.
So I'm going to do my chemical peel, and then I'm going to wipe off all the excess acid. And if it's a medium depth blue peel, that's the first one I do. If I'm doing a modified phenol peel, like a header peel around the eyes, that's my second peel, because that's deeper. So first I do the lighter peel of the two, and then I do the deeper peel, and then I remove all the acid from the skin, and then I do the laser resurfacing on the areas I'm going to laser, and those are for the deep etched in lines, maybe in the glabella, maybe around the mouth. So that's where I'm going to do my laser. And then I'm going to proceed with the surgery. And if I'm undermining for a facelift, then I'm not going to be as deep over the flap. So the peel is going to be deeper on the forehead and then the central face, and less deep off to the side. But even with blepharoplasties, I will peel the upper eyelids up until the incision line. And the skin will heal much better. We already know that blepharoplasty incisions heal beautifully. But, you know, if you peel right up onto that line, it's not going to affect, you're not going to go that deeply, just feather onto that area, but go a little more deeper on the skin you're not excising, which is the skin of the subbrow region and the periorbital area. So I like to combine the two.
Also, just when you, I'm so sorry, I interrupted. I noticed that most of my patients are very reluctant to use their skincare around their eyes, but I think we have to sort of tell them and reassure them that it's all right to use our skincare regimen around our eyes as well, right? Please correct me if I'm mistaken, because sometimes I come across patients who are looking amazing on their cheek area, you know, on their chin, but they still have those hyperpigmentations around their eyes. It's kind of like a panda bear or like a raccoon, you know? And they say, I don't want to get the product near my eye because my eye skin is very sensitive. Is there any kind of adverse effect for getting these topical agents around our eyes, or is it just safe and they should just go for it?
So that's also a very good question. That's why I go to great pain to make sure that my written instructions for each patient tell them exactly how much of each product to put on and exactly which parts of the face to put it on. So I always tell them, upper eyelids, you do it once or twice a week. lower eyelids, you do it every night or every morning with each of your steps. And I tell them that while they're there. And you still will see people who are hesitant. And then they'll come in, they say, well, I read online that you're not supposed to put this near your eye.
Right.
And I'm like, well, which one of us is the doctor? You know,
Right.
if I'm telling you to put it near your eyes, it's because it's safe. I'm not telling you to put it in your eye. I mean, but you have to go to great pains to actually stick the product into your eye. So as long as you're treating along the lower eyelids, that's the thinnest skin on the body. That's the skin that's going to age the most. That's the area you really want to put your products. And the good thing is if they're very sensitive and they're not able to tolerate, for example, your retinoic acid around the eyes, then Retivance is a phenomenal pre-retinoic acid type of agent that you can put around the eyes. It will build collagen, it will build elastin, and it will firm up that skin, but without a lot of the irritation that they get by using a retinoic acid. And
amazing.
The polyhydroxy acids in the intensive daily repair are a bit stronger than the alpha hydroxy acids, for example, that are in the Exfoderm. But even though they're stronger, the pH that they're active at is at a more neutral pH compared to the alpha hydroxy acids. So that when you put it around the eyes, you don't get the same stinging and burning that you would using an Exfoderm product. So if someone can tolerate Exfoderm around the eyes, great. If they cannot, intensive daily repair is a phenomenal way to also be able to treat around the eyes without getting a lot of irritation.
Well, that's perfect. Well, I love IDR. It's my favorite product that I use on my face. So thank you for formulating it, Dr. Obagi. Can't live without that. Also, I wanted to ask, so sometimes we come to the peak point with our patients. So they're on their topical treatments. We've done the surgery. They look amazing. And they ask, you know, am I going to go with the new derm system forever? Is this my holy grail for the rest of my life? Or am I going to, you know, need to sort of stop it every once in a while and then go back to it? They basically say, will my skin get too used to it that it's not going to respond the same way that it does? Is there like a rebound effect, or are there times when we have to sort of have little pauses in between? Something that they ask me every now and then, which I would love to ask you.
And I do the same thing. So I like to cycle the regimen depending on what we're planning. So if we're getting ready to do a procedure, the regimen is going to be a little more aggressive. If we're going into a maintenance phase, no, I want them to be compliant. Compliance is the key. And so I don't want them stopping a new derm and then drifting off onto products that are not going to be efficacious for their skin. And that's exactly one of the reasons why we formulated the Suzan OBAGI MD line. It's because there was no other transition regimen for patients. They were either on new derm 7 days a week or on new derm 3 or 4 days a week, and then using God knows what on the other days of the week and maybe negating some of the benefits that they were doing. And to me, that doesn't make sense, because you're investing time, effort, and money on a good regimen, and then to only use it a couple of days a week and then use products that might reverse that isn't what we want. So I wanted to bring to the Obagi family another line that's equally efficacious, but can be used as your stopgap. It can be used as your transition line when people need to go on to maintenance. And you know, that line's very effective. It's just not going to dry and irritate the skin. At the same time, maybe if they start to spend a lot more time outdoors in the sun and they're starting to relapse, we can then shock the skin again with a 6-week course of new derm and get through one whole set of the products and then go back again onto the Suzan OBAGI MD line for their maintenance and continued improvement that way.
Perfect. Also, one more question, because I have lots of patients who sort of start out with me. We do surgeries and they're always coming back and forth with follow-ups. I do some minimal invasive procedures on them, like neuromodulators or fillers or mesotherapy, PRP. And sometimes, for example, you know, they get pregnant or they're lactating. At this point, they ask, because they're always very knowledgeable and they want to know, are all of these products safe to use while they are pregnant or while they are breastfeeding? Is there anything that they should discontinue, or they should switch to something else during these more sensitive times?
Correct. So when someone's pregnant, we have them stop any of the prescription agents, such as the clear which has the hydroquinone in it, or such as the retinoic acid. And I also have them hold off on the Retivans just to be extra cautious, which has retinaldehyde. So retinoids and hydroquinones, I would stop while you're pregnant. When you're nursing, you can resume all of them again. You're not going to get even any measurable amount in the breast milk that's going to then impact the baby at all. So I have them stop everything. But when they're pregnant, the problem is they're going to still have issues with melasma, and it's going to sometimes come out while they're pregnant. They're going to have issues with acne. So it's still important to do something to take care of your skin while you're pregnant. So if you're prone to pigmentation issues, pregnancy can worsen that because there's that hormonal drive on the pigment cells. So it's absolutely essential that those patients are still doing something with an antioxidant, like a vitamin C serum or the polyhydroxy acids, which are potent antioxidants just in and of themselves, as well as our newer sunscreens that have the mineral defense in them. At the same time, they have the antioxidants in them, so that we know that when you control inflammation in the skin, you're going to control the amount of pigmentation that forms. And so antioxidants, you're going to see more and more. And I'll just give you a teaser about some of our new products that are coming out next year.
Oh,
it's
amazing.
all about controlling inflammation. And when you control inflammation, you're going to control pigmentation. So these patients can still do something every day. They should be using their sunscreen every day, but again, not a chemical sunscreen. It must be zinc-based, titanium dioxide, and if possible, the iron oxides in there and the antioxidants in there. So they can do so much while they're pregnant to still protect their skin. And at night, they can still help to minimize acne by using exfoliating lotion such as the Intensive Daily Repair or the Exfoderm, so that they're keeping their pores open. And those help to hydrate the skin, and they help to kind of stimulate to a slight degree some more collagen production in the skin. Not as much as our retinoids, but they still have a minimal effect on that. So they're doing something good.
Perfect. So when would you, the minute they stop lactating, or even when they are lactating, we can start them on retinoids. Is that correct?
Yes.
Just not during the pregnancy. So
Correct.
they just have to hold off for 9 months. That's it.
Exactly. And you know, I love to see that a patient is so dedicated to their skincare regimen that they can't wait to get back on it.
Absolutely.
But you know, I was excited the other day because I had seen this one patient back early in the quarantine period. I did a telemedicine visit with a patient in her late 50s, and she had so much sun damage that it was going to be a huge, huge ordeal to get her skin to look fabulous. So it was going to be a combination of products and peels and lasers.
Right.
She sent me her 24-year-old and 22-year-old daughters to come in the other day for a consult, and they've got beautiful skin. And now I just can't wait because I can teach them at 22 and 24 how to look phenomenal the rest of their life.
That's amazing. That's amazing.
So
I think that's the power of
communication.
Patients. Absolutely. Absolutely. And also, I'm so sorry. I'm just, just adding on questions because I just have so much to ask. But sometimes, we have our patients who just follow their regimen, get all of their minimal invasive procedures, their lasers, their surgery, and their face is looking amazing. But unfortunately, the same isn't really going on with maybe their hand surface, their décolletage area. And they say, I'm not having, I don't really do the same thing for, my chest area or my hands. What do you do for the anti-aging and sort of controlling the photo damage in these other areas, like not the face, but the other areas that sometimes go unseen during the winter times, but then when patients start wearing more open clothes, in the warmer months, they come and they say, this area is just not looking very good. What would you recommend for that?
Well, I'm happy also to share with you, if you email me, my handout that I give patients on how to use the products and how much to apply and where to apply it, because in big letters, it says on there, you're to do your face every single day. And that's your morning routine, your evening routine. you're to do your neck and V of your chest twice a week with everything. And you're to do the backs of your hands every single day with every step.
Well, there's my answer.
Because I don't want to wait. And I tell them, even if they come in the middle of winter and they're dressed like I am right now, I tell them, I can't see below here, but the thing is, you don't want this to age. You want the V of your chest, you want your neck to look good. And we know that there are now better ways to resurface the skin of the neck and chest. It's not perfect, but we can still do chemical peels, medium depth chemical peels on there. I'm dabbling with a fractionated CO2 in a very gentle form to try to also firm up the skin of the neck. But the skin of the neck is like the skin of the lower eyelids. If you wait until it's damaged, it's very hard to fix that.
Absolutely.
So you have to, in each consultation with every patient, tell them, do not neglect your neck and your chest and the backs of your hands.
Absolutely. Going back to the eyelids, you mentioned that you recommend using the regimen twice a week for the upper eyelids and every day for the lower eyelids. Also for patients who want to do something extra for their eyelids, the Elastoderm cream is also very, very, I would say, amazing because patients love it. How would you recommend incorporating that also into their regimen if they are to use the Elastoderm eye cream as well?
So what I have them do is I'll have them put their morning routine on, and just before their sunscreen, they'll put the Elastoderm on. So kind of as the last step right before their sunscreen. And the sunscreens, again, should be going around the eyes. They're not going to peel or make the skin burn or tingle or make your eyes water. Because a lot of people are very sensitive to sunscreens. And if they get them too close to the eyes, they can't tolerate it. But that tends to be the chemical sunscreens. And again, that means they should be looking at the ingredients on their bottle and making sure that they're using mineral sunscreens. And then at night, if I find that they can't tolerate a retinoid every night around the eyes, I'll tell them use the Red Advance maybe 5 nights a week around the eyes, and then the Elastoderm 2 nights a week around the eyes.
Perfect.
And that way they're doing something every night, everywhere. What I don't like to moisturize before a retinoid or after a retinoid, because to me that's just diluting the effect of it. Because a lot of times patients are like, well, when do I put my moisturizer on? I said, you don't need an actual product that is called a moisturizer. That's not an essential part of each step. If you're using your products correctly, your skin is making its own natural moisturizer, what we call NMF, natural moisturizing factor. That's an actual product that your skin makes. We make it when we're young. That's why little kids don't need to take a shower and then run and put a moisturizer on after they come out. But we lose that ability. But when you fix skin and make it healthier, it starts to make its own moisture again. I don't use a moisturizer. I don't have a moisturizer in my cabinet, even though I love the Hydrate and the Hydrate Luxe. I will use that for patients with extremely dry skin. I find that most people with normal skin, if they're using their Exfoderm or their intensive daily repair correctly every morning and their sunscreen, that is plenty of moisture for the skin.
Absolutely.
And
also,
the Soothing Complex gives so much hydration. I absolutely love it. Somebody asked in one of the questions, what do I have on right now? I have my intensive daily repair and I have my Soothing Complex on right now. I have no makeup on, no filter on my camera, and it feels soft. It feels hydrated, but I'm not greasy and I don't have a sheen on there.
I love the Soothing Complex for after procedures. I think it just gives an amazing hydration and sort of, it just locks in all of the moisture. It just makes all of the redness and the sort of irritation go away, and also gives like a very minimal hue, like a little tint to the face, so the patient is very happy when they're walking out of the office. And do you also incorporate it into normal skin care as well? So I personally tell patients to use it after procedures, but could this also very well be used for just a normal skincare product as well?
Yes. So I love the Soothing Complex every morning instead of a stronger sunscreen if you're just sitting in the house and or working at a desk or walking around with a mask on, because it's going to help to hydrate your skin without you feeling you have to put on extra moisturizer, which can then break you out under your mask. So I have patients using their soothing complex every single morning, regardless of a procedure or not. And then if they're going to be outdoors in direct sunlight a little bit longer or near a bright light all the time, like a window, then I'll have them put their sunscreen on that's an SPF 40 or 50 on top. And they can put it on top of the soothing complex if they want, if they're feeling extra dry, or they can put it on instead of the soothing complex if they're not feeling dry that day.
Perfect. Also, I would like to ask your opinion about a very controversial topic that I've been hearing a lot about. Some people are putting Vaseline over their normal skincare routines to sort of just lock everything in. Do you think this actually has some kind of benefit, or is this something that people should stay clear from? Because lots of patients are saying, you know, I just bought this Vaseline. And in fact, I think it's called slugging. So it's kind of just, yeah, they call it slugging. And they sort of just do all of their normal skincare regimens, and then they put this big sort of like layer of Vaseline over their skin to sort of just block everything inside. Does this make sense at all? Because I've had a couple of patients ask me about this, and I've seen this. I think it's quite controversial, so I wanted to get your opinion on it.
A couple of things. One thing I don't like is to overly occlude the skin, and there's nothing more occlusive than a petroleum-based product. It's a petrolatum-based product like Vaseline, like Aquaphor. They're so heavy. And so they're mainly supposed to be used for people with impaired skin barriers, like people who are having a severe eczema flare, people who are having post-procedure, after laser resurfacing, that skin is compromised and you're losing tons of water and fluid from the inside out. So you need that barrier there. But to just take normal skin and put Vaseline on top of it, at first might interact with the products you put on, and interfere with their ability to work properly, especially when you have a product where the product doesn't mix well with, so if you have a lotion, that lotion is not going to mix well with the Vaseline type product. So now you're going to interfere with what you're putting on your skin. That's why it's much better to really follow the advice of your doctor and layer your products on as we tell them with the quantities we say, and not to then add in anything else, because they might be taking this very good regimen and then diminishing it.
Absolutely.
And I'm not a fan of putting too much petrolatum-based products on the body in general. I think the more we can minimize that benzene type of ingredient, the better.
Absolutely. I just think there's a lot of misinformation out there right now, because there's just so many different channels to sort of get misleading information. Even if it's correct for some patients, it may not be correct for all. But unfortunately, social media, as powerful as it is, it can also be a little bit dangerous to maybe get some not very good information as well. So it's very important to inform our patients. So thank you for that update as well.
Absolutely.
I don't know if we're coming to a close with our time. I can talk for hours and hours.
A patient was asking, or somebody was asking, so did we say yay or nay on the petroleum jelly or Vaseline? I say nay. Don't do it.
Okay. I say whatever you say.
And I was just checking to see, we had a couple questions come up, but I think we already answered them. The one thing is, the question was, what's the difference between blender and clear? And if you don't mind, I'll just answer that real quickly.
Please go ahead.
Clear and Clear FX are skin lightening agents that have hydroquinone or arbutin respectively in them. Blender and Blender FX are the same thing. They have 4% hydroquinone and arbutin, depending on which of those products you're using. But the base is a little bit different in the blender, so it helps it to emulsify a little bit better with your retinoic acid that you're putting on the skin. And it's a way to layer a little extra dose of the hydroquinone or arbutin onto the skin. So if someone is prescribing one of those products or both of those products for the patients, then take the advice of your doctor and definitely use both. You don't want to stop one or the other. All right.
Any other questions from the audience?
I think we've talked and covered quite a bit of them. So it has been a true pleasure. And I'm hoping one day you'll come visit us here in Pittsburgh as well.
Oh, hopefully. I'm looking forward to that day very much. Hopefully we're going to get rid of our masks. We're going to get rid of COVID, get our vaccines. And I saw that you got your vaccine today.
Yes.
So
happy.
Congratulations on that.
Thank you.
Perfect.
And I hope everybody, if you don't have a medical reason not to get it, I hope everybody takes that vaccine so we can really protect our family, our loved ones, and try to get back to some sense of normalcy. What I miss is being able to have a conversation with my patients without a mask on my face and on their face, so I can see their beautiful smiles and actually interact with them.
Absolutely. I agree. And hopefully 2021 will be the year we can rejoin and reunite and just
I hope so.
Yeah, take everything back into our own hands in the best way possible.
Absolutely. So on that note, Happy New Year.
Oh, thank you so much. Happy New Year as well. And thank you so much for this lovely live session. It has been very beneficial to me, and I'm going to take all of this information back to my patients and incorporate it into my daily routine for their treatments. Thank you so much.
Take care. Thank you. Bye-bye.
Thanks. Bye-bye.